social media and COVID. These two have just throughput the whole screen time to a whole new level.
Screen time can cause eye problem.
For sure. When somebody is viewing a screen, whether it's a mobile, a computer, a laptop, iPad, or a TV, any screen, the blink rate drastically comes down to 5 to 10 per minute. 15 to 20 blinks is a must have for anybody at any point of time per minute.
So how bad is blue light damaging the retina?
The blue light, if you look at it, most of these glasses or protective eyewear have about 30 to 50% blue light protection. That's not enough.
So what are the small tips that you can give us to prevent blue light exposure?
So the first thing I would tell people is stop viewing any screens after 8 p.m. Second is please change your phone settings to a night mode or to a mode where it's much more friendly to the eyes. Third, there are about 8.1 billion people in the world. Close to 1.1 billion people in the world already have uncorrected refractive error. That alone is going to increase tremendously because of the screen time that is involved, because of the digital eye strain that we are putting ourselves through, no outdoor activity, and an increase in amount of other attributed factors like...
What is the 20-20-20 rule?
Okay, that's a brilliant question, and I think that's a huge thumb rule that people going to offices, specifically between the ages of 18 and 40, can use in their own daily lives.
Welcome Dr. Ash to the show. So good to have you here.
Such a lovely pleasure being here with you, Dr. Pal.
I have this beautiful scenario to explain to you. So I was, while I was working in the hospital in Sacramento, one of my junior residents, he was rounding with me. And while he was rounding, his eyes just started watering. And he was just kept on wiping the tears and everything. And then he said that, I just didn't sleep properly last night. So later, what has happened is he was so busy in his work to a point that while he was doing the procedure, endoscopic procedure, he called me. He said, Dr. Pal, I can't see. It was an endoscopy procedure where he was to take a biopsy of the stomach. And while he's doing, he was like, he can't see properly.
Right.
So then we rushed him to the ophthalmologist and he started having an ulcer in the cornea. It turns out that he has been having dry eye for a long time that he was not aware of. And just wanted to ask you, how common is that in your practice?
So thanks for asking this question, Dr. Pal. I think dry eyes, actually, if you look at it, is one of the most common symptoms, signs and symptoms of a patient coming into the clinic. Why is it happening? What's happening here? There are a multitude of factors that involved in dry eyes. Although we just say there's 3-letter word dry eye, but actually what it is environmental. So they're in AC all the time. There is always a fact where your screen time is increasing, so you're always viewing screen.
AC decreases the hydration.
AC reduces the hydration of the eyes because you're evaporating the aqueous layer from your tears. Tears are made up of 3 layers. There is an aqueous layer, which is in the middle. You have a mucus layer that is attached to the cornea, and then you have a lipid layer on the outside. So you have the mucus layer that helps take the aqueous layer and absorb it into the cornea. Because the cornea itself, if you look at it, is actually hydrophobic. It does not like water. It does not like aqueous. So it needs a mucus layer for it to absorb the aqueous into the eye. The lipid layer, on the other hand, which is the outermost layer, helps prevent any evaporation of this aqueous layer. So there is a very clear demarcation why these 3 layers are present in the tear film. Any disruption in any of these 3 layers can cause a big issue of dry eye syndrome.
What a fascinating anatomy, huh?
It's a fascinating one.
So the outer layer is fat.
Lipid layer.
Inner layer is filled with liquid.
liquid.
That's where your tears and everything having a good hydration.
Correct.
So when
And
the
the
outer
mucus layer is in under the aqueous.
under the
That is
aqueous,
touching the cornea,
touching the cornea. Cornea is your covering of your eye,
the window, the black of the eye.
black of the eye. So this fat layer is protecting. So anything that is disrupting the fat, it's basically as an opening to reach the.
So what happens is that different glands secrete these three layers. The aqueous is secreted by the lacrimal gland. The meibomian gland, which is on the lid margin, secretes the lipid layer. So any disruption in the meibomian gland will have lipid layer loss. Any disruption in the lacrimal gland will have aqueous layer loss.
Lacrimal gland is a gland that secretes tears.
Correct.
Ah.
It secretes the tear. The so-called tear is only the aqueous.
Aqueous.
But there are two more layers which are extremely important in tear film or in dry eye syndrome.
Wow.
So all these multitude of factors, so there can be environmental factors, there can be a genetic factor that can cause this, there can be a gland related issue that can cause this, there can be social interaction, that means your social media as you call it, and that's been a big revolution. That's one of the main reasons why today you're seeing an increase in dry eye syndrome. You're also seeing increase in red eye syndrome. You're also seeing increase in myopia, and especially the younger adults and the children. So multitude of factors. You can even call it, stress. This sleep is disturbed. The cognitive functions next day are disturbed. Mental health issues. Multitude of factors coming just from screen time.
So
And
screen time can cause eye problems.
For sure. Especially increased screen time that all our age groups. I mean, regardless of 5 to 95, all are facing the same issues.
What happens because of prolonged vision screen time?
So the minute you're doing anything prolonged screen and any kind of prolonged screen time, and let me just give you a small analogy to this, not analogy, a story to tell actually. We were all introduced in 1999 to the dot-com bubble. The internet, the so-called internet came about. Then you came 10, 12 years later into the so-called mobile phone generation. That became very proficient. But it still didn't increase the screen time until the social media came into play. Once you got social media in your hand, you have the power of independence, power of freedom, so much more to do. And that increased the screen time to a substantially high level. This happened, probably 2016, 17. 4 years later, COVID happened. Now everybody's sitting at home. And this broke out a complete new epidemic. An epidemic of screen time came about because of two main factors, social media and COVID. These two have just throughput the whole screen time to a whole new level. So multitude of these factors, increased screen time, can cause dry eye syndrome, I already said, red eye, increased myopia you can have increased amount of sleep deprivation, because think about it, what is a screen? It's blue light being emitted. This blue light straight away creates a block in melatonin. This block in melatonin disrupts your sleep straight. Not just sleep, it increases your body temperature, it activates all organs immediately, because you're releasing dopamine as well. So you're releasing dopamine, so your body activity of brain, liver, kidney, heart, body temperature, all are going up. You're not able to sleep for 2 hours after you are on screen. And check with everybody. If you're constantly doing this, you're not sleeping before 1 a.m.
So how bad is blue light damaging the retina?
So if you have a natural lens in the eye, the blue light's pretty protected. Okay? But the blue light which you are emitting from the phones can pass through. So that's what's causing the melatonin being blocked, not able to sleep, leading to cognitive dysfunction, leading to sleep deprivation, mental health issues because of not of sleep only, but also because of other aspects. Let's say, for example, you're thinking about comparing, oh, my life is like this, and you know, those aspects as well is a huge angle to it. So stress is caused because of that. There's a multitude of factors that can lead to this from blue light itself, just purely blue light.
Very controversial question now.
Yes, absolutely.
US, where I am in California when I'm practicing, having blue light filter glasses,
Yes.
right? So it is I would say a fashion symbol. So everybody is having this orange color, completely big glasses, which is completely filters the blue light. That's what they claim. But when you look up the research, the support and evidence of blue light filter glasses is not that much based on what I looked at. In your practice, what will you say?
The blue light, if you look at it, most of these glasses or protective eyewear have about 30 to 50% blue light protection. That's not enough. You at least need a 95%, 95% blue light protection for you to have any good impact.
Wow.
So that's the first step. So having said that, there are, in today's world, blue light does not help you reduce your screen time. It probably will help you reduce the melatonin
Correct.
stop a little bit. So
Little
your
bit.
sleep is improved, and that by far indirectly helps you overall health. It's not a direct correlation as we call it, but because the eyes are the windows of for us, windows to the world, that's why the eyes are the one area where blue light can be protected. So you have to put all these
Everything
things together.
So based on what you said, my understanding is blue light filter glasses does decrease the blue light exposure, but not completely. That 40-50% will decrease exposure, so your melatonin might be increased a little bit. That'll help you. Basically, you can think that as a band-aid.
It's a band-aid.
A little bit, but the problem is still
The
this.
problem is screen time. The problem is the amount of time and the timing. It means ideally, I tell people you can't be unrealistic in today's world and say, don't do screen time. That's unrealistic. In today's world, you need screen time. You need to work. You need to be connected to people. We are all social animals at the end of the day. So, having said that, I would definitely recommend don't do it after 7 o'clock, 8 o'clock. Just try to protect yourself from that because you miss that circadian. Most of us have a circadian rhythm where we sleep. If we don't sleep by 10 o'clock in the night, we miss that window of sleep and then we are sleeping at 1 a.m. That's a drawback. So you try to stop your blue light or any screen time by 8 o'clock. If you do that, you're able to sleep by 10 o'clock and you'll get a good night's sleep. A multitude of factors, again, you can add coffee is not good, this is not good. That's each personal preference. But this is a direct correlation to how your body reacts to melatonin and blue light.
Wow. So let's say that I want to get blue light filter glasses, correct? What should I look for when I go to an optometrist? I say that, hey, no, the question should ask is how much percentage that it will decrease.
For definitely, please ask everybody to have a 90 to 95% blocking blue light filtered glasses.
Is that possible?
That is possible. But I'm not sure if it's fully possible in India yet.
I see.
It's there in the US, I know, but I'm not sure if it's completely there in India yet.
So a better thing to say is maximum blue light protection as much as possible.
Yeah. Not just glasses. They have blue light protection filters for the laptops. They've filtered protection for screen guards for your phones. There are filtered protection for even your TV screens. So there are different variations of how you can protect your eyes from blue light.
And another interesting question to you.
Please.
I always wonder what will be an answer from your ophthalmologist. So in US, we do research on circadian rhythm, right? So I work with mice, and then we expose them to light purposefully after 7 p.m. when the sun sets, and then see what are the change that's happening. So one of the interesting experiment is we changed all the LED lights in the lab into in India, most of the time we use the white light.
Right.
In US, it's most of the times it's the dim light, the orange light. So we kind of switched back and forth, and then we figured out that the dim light, the orange light, actually have less stimulation in the mice compared to the white light. Is that something that you have seen with the photosensitivity?
So it's a yin and yang over here Dr. Pal, you've asked a very, very dicey question to an ophthalmologist, because I'm the one person who is recommending people to increase the brightness, increase the light that you're reading in. Because the minute you're reading in low or dim light, although you're helping the circadian rhythm, you are not helping the refractive error.
I see.
So you're pushing the eye to strain a little bit more, because in dim light, you have to focus a lot more to actually read that line,
Ah,
versus your circadian rhythm is good, you'll be able to sleep fast, all that stuff. So it's a very, very dicey question to
I see.
ask. I
An
mean,
ophthalmologist.
an ophthalmologist.
How about the solution? You do dim lights throughout your house. While you're reading, you have the clip-on lights.
Correct. That's a brilliant point. So if
Correct.
you're reading something specifically from a book, please do it from a reading, from increase the light on that book. The second very important thing, because most people, at least what the surveys say, is that 80% of all of us are all reading things only on our mobile phones.
Yes.
80% of
I am
whatever
on that
we're
80%.
yeah, we're all in that 80%, right? So if you're reading things on our phone, the first thing, go and change your settings on your phone to making it friendly for you. So there are sepia modes, there are night modes that you can have your screen in specifically after a particular time, so that this blue light emission and the amount of brightness that you have is reduced, especially in the evening hours when you want to be able to sleep, get a good night's sleep, and go back to work next day morning. So those settings are important. Another small tip that I can tell people, they have new voice inputs, audio notes, or voice to text translation. Please use that more often, because it reduces your screen time from typing. You don't need all you have to do is look away and start talking to the phone. And that's a much far better, more efficient method to use in today's world.
Wonderful, wonderful. I do that all the time. Initially, it's slightly difficult because it has to get accustomed to your accent.
And our accent is pretty tough also.
But it picks up very well. I have, and also I use in WhatsApp. I use the voice note all the time. I don't text that much.
It has helped. It definitely reduces the screen time. So I try to find hacks in today's world to give to audience or viewers or my patients about how to use your time efficiently and reduce your screen time efficiently. So that's a good marriage that we need to start bringing about in our lives.
When you explain this to your patient, how receptive they are
Initially,
in your practice?
yeah, this is a good question. I think about 50% receive the information, but only about 25% of that 50 only take it and actually do something about it. Although, if I meet the same patient 3 times, by the third time, they're much more receptive. They're much more receptive because they know that this problem is not solved by not doing something. And now, okay, I have to listen to this guy.
Correct.
So,
The problem is progressive.
Progressive.
Progressive. Right.
and in clinical practice, you meet the patient for like 4 or 5 minutes max. You're not able to impact them to change their lifestyle. You're not telling them a treatment, okay, come do this for 30 minutes and go. No, they have to do this on a regular basis. They have to change a habit. So it's habit stacking on top of all the work and the stress and the family life that they have to lead. So it's kind of unfair on us also to kind of expect them to change overnight because somebody told me to do something.
Right, right. Of course, of course. So, what are the small tips that you can give us to prevent blue light exposure?
So the first thing I would tell people is stop viewing any screens after 8 p.m. so that you sleep by 10. The second is please change your phone settings to a night mode or to a mode where it's much more friendly to the person, to the eyes. Third is ensure that you can go and buy some protective wear on the devices that you use pretty much oftenly, especially the phones or the computer,
Like a blue light filter.
like a blue light filter. Make sure that you are doing 90 to 95% protection. Don't go for the cheaper 30, 40, 50% protection ones. They are not efficient at all.
What do you do as an ophthalmologist on your phone? What is the trick?
So I change my settings to a night mode. Specifically after 6 p.m., it automatically changes to a night mode. no matter what.
Do you change the color filter?
I don't change the color filter. I change the setting to a night mode.
Night mode on is good.
Night mode on is.
So in dry eyes, you are basically evaporating the tears because of your prolonged use. Correct?
I'll give you. I'll break it down in a little bit different way, Dr. Pal. Let's call it digital eye strain.
Okay.
Okay, because that's what's really happening. The digital eye strain has 2 or 3 components to it, right? One of them is dry eye. The other one is the so-called computer vision. They can be synonymous in many ways, but let's just try and break this down, because there's much more that's happening, and especially catering to a younger population, especially the infants, toddlers, and young adults, young children and adults. What's happening is, when they are viewing screens as often as they are prolonging the blue light exposure. They're prolonging their time for evaporation of the aqueous. They are also reducing the number of blinks. So I think the microliters, nobody will be able to go and measure how many microliters. It's not fair. Let's talk about blinking.
Blinking actually helps preventing dry eye.
Hugely. Make a conscious effort to go and blink more, even if you're in front of the computer. Just think about what I'm going to say next. 15 to 20 blinks is a must-have for anybody at any point of time per minute. 15 to 20 blinks per minute. Now, we've done enough and more evidences to see that when somebody is viewing a screen, whether it's a mobile, a computer, a laptop, iPad, or a TV, any screen, the blink rate drastically comes down to 5 to 10 per minute.
Almost 50%.
Lesser than that. So what happens over here is you're dropping the blink rate. What is the blinking doing? It's basically spreading the tear across the eye. The tear brings to your cornea and your vessels and your conjunctiva blood. It spreads the blood. It takes away the toxins, brings in nutrition. All that's happening with that one spread over an aspect of diffusion. So it's diffusing into the eye. I'm trying to be as layman as I can, because I think that's
it's very critical.
Extremely important to explain to people why blinking is important, why you should blink a little bit more. The other thing that's happened is people are not going outside, especially the younger age group. They're sitting in their houses and playing on iPad, phone, under the AC. And this is now chronic.
It's not one time.
It's not a one time. So they're not going outside. They're not seeing distance. They're seeing near. So eye is always in strain. Digital eye strain. Why strain? Because they're always flexed. Imagine keeping your muscles flexed all the time. It's not good for you chronically. There is no sunlight exposure. There's no open, far distance viewing. So accommodation is being affected. There are multitude of factors. I'll just break it down once more. Blink rate, outdoor exposure, your number of times you're seeing screens, your increased screen time, your perpetual flexion mode of your eye, specifically in contraction when you're seeing these near objects. All these attributes to digital eye strain in today's world, even in younger children and adults, let alone the older age groups, have a major problem there. They have other aspects to deal with.
What is the 20-20-20 rule for dry eye syndrome?
Okay, that's a brilliant question, and I think that's a huge thumb rule that people going to offices, specifically between the ages of 18 and 40, can use in their own daily lives. So I'll give you 2 major, huge thumb rules for anybody who's sitting on a desk, and there are at least 1 million or more people who are in that field doing this computer vision, doing computer work. The 20-20-20 rule is very simple. For every 20 minutes, for 20 seconds, view something 20 feet away from you. Simple. 20 minutes, 20 seconds, 20 feet away from you. Just view something for 20 seconds and then start doing your work back again. This is one. Second thing that you can do for digital eye strain. So 20-20-20 rule, the second thing you can do for digital eye strain is palming. Basically, cup your hands when you're in the system. After an hour, just palm for 20 seconds and go back to your normal routine.
Like a massage.
It's not even a massage. It's just close your eyes and cup.
Oh,
Just close your eyes and cup.
like cuffing.
That's it. Don't even press on the eye.
Ah.
It'll give you an absolute sense of relaxation, brings back the blood supply. Small things, but they go a huge way if you're doing it chronically. If you do it once in a while, it does not help. You have to make it a habit. These are two things you can do. Cold compress and hot compress can be definitely used, specifically when you come back home. People put cucumbers, right? It's not just cucumbers they put cold cucumbers, so that cold compress helps increase blood circulation. The hot compress helps not just blood circulation but also helps secrete some mammalian gland lipid layers, opens up the pores of those lipid layers and secretes those
Wow. I thought cold cucumbers to get more fair skin.
I mean, you can get some dark circles removed, is what they say. But these are some of the aspects that can really help digital eye strain. For younger children, I would definitely say ensure that they do outdoor activities, sunlight, and far distance.
Let me ask you this. Why should we worry about all this dry eye, digital strain? What are the complications?
It's so the complications of dry eye at a younger age group is, first of all, the incidence of myopia.
Myopia is you cannot...
Nearsightedness. So basically what's happening is the incidence of myopia the studies have revealed that by 2050, half the population of the world will be myopic.
Wow. They can see only nearby. They can't see anything farther behind.
So they will have a huge problem of myopia, and it's increasing at a tremendous
What
rate.
are you talking about? 1 in 2 people will have myopia by 2050? Oh my God. I am myopic.
I give you an analysis. There are 8.1 million people in the world. A billion.
Billion.
Sorry. There are about 8.1 billion people in the world. Close to 1.1 billion people in the world already have uncorrected refractive error.
Some kind of eye problem.
Some kind of myopic or some refractive error. That alone is going to increase tremendously because of the screen time that is involved, because of the digital eye strain that we are putting ourselves through, no outdoor activity, and an increase in amount of other attributed factors like blue light, melatonin not being secreted, dopamine being secreted, you're not getting sleep enough, cognitive function going away. All of these will add up.
So the factors that you're talking about, I'm looking from my selfish reason.
Yeah, absolutely.
Where I am seeing my kids, and it's a very common thing to have screen time for the kids. Based on what you're discussing, I'm thinking along the same scenario where my son is looking at the screen, not at like a 1 arm distance or anything like that, right? So he's straining his eyes. The longer, then evaporates and dry eye and all this comes in.
Correct. The eye muscles are very involuntary muscles. They're not a voluntary muscle that I can flex and close. I can flex and release. No, I can't do that with the eye. If I put something in front, in order to view involuntary, my eye has to flex. I'm not
focus on
to focus on it. Now what's happening is, now it's in perpetual flex mode. Instead, now if I send them or I incentivize my kids to play outside, you have to incentivize. You'll be smart in this today's world. Please incentivize your kids to play outside. Go and play a sport for 1 hour every day outside, whatever it is, especially in the younger age group. So those are small things that you can do. Incidence, as you asked me, what is dry eye complications? Incidence of myopia is according to be the number one complication of chronic dry eye. Not just dry eye, digital eye strain. I'm adding all of this together.
Of course.
The second complication of dry eye is infection, as you said earlier.
For that, my resident.
Your resident. Could be an infection of the eye that was chronic in nature before, from the chronic dry eye he was facing. It's gone into an infectious mode because now the immunity is dropped. There's not enough tear secretion. There's nutritions are not coming in, the toxins are not going out. What's happening? You're creating a state of stagnancy in the eye, and it leads to one little bacteria, one little virus from outside coming in. Adenovirus is known to do this. Causes an infection of the cornea, rush, start drops, if not taken care of pretty well, can lead to even a complete ulceration of the cornea, can lead to transplant of the cornea, vision loss, multitude of sequential events that are happening that are completely now out of your control.
How often you see this in your practice?
Oh, corneal, so I'll give you a simple scenario. In the group, we do close to about 1,000 transplants a year. Corneal transplants, 1,200 a year. Pretty much all of them are based out of some dry eye or complication of.
Oh my God.
Yeah.
That's 100 a month.
Yeah, it's a huge number.
It's a huge.
That's a
and
huge
the
number.
number is increasing?
The
Or-
number is increasing, but because of good protective or preventive mechanisms being put into our branches all around, there have been a reduction in severity of them. It doesn't mean the chronic dry eye disease is going away. That is on an increase, but we're able to prevent it from going into transplant mode. We're able to protect the transplantation mode, but it still comes through. I mean, you have those filtering still coming in where you have a lot of patients coming in for dry eye.
I think this is a perfect time to talk about corneal transplant as well. So I'm just summarizing what we have discussed so far, where chronic exposure to the phone, longer screen time, drying of the eyes, lack of blinking creates a lack of tears, and that increases the risk of dry eyes. When there is dry eye, the immunity in the eye fluid can go down, bacterial and viral infection can infect, and it can cause ulcerations, which can eventually lead to corneal dysfunction, which might require a corneal transplant. So this is what we call it as eye donation.
Correct.
And eye transplant.
Correct.
It's not the whole eye, it is just that surface of the
Absolutely.
eye.
Absolutely. So the eye basically is made up of a multiple factors. It's the most complex organ in the body. It's got a trillion neurons.
I thought there was a gut.
Let me put it this way. It is the most complex small organ in the body. Okay. But the way I look at it is, it's got a trillion neurons because it's an extension of the brain. The optic nerve is an extension of the brain.
Yes.
It's got a trillion neurons. It's got vessels. It's got a transparent cornea. It's got a transparent lens. So it needs to keep it transparent. And the function of these fluids are to make sure that nutrition is still going in and keeping it transparent. So it's a complex organ. The complete myth here is eye transplant can be done. You can never take out a complete eye. Once that optic nerve is cut, it is cut for life. You can't put back a trillion neurons in. Okay, that's the first. What can be transplanted? Until date, scientifically, we have only been able to transplant the cornea. There have been some studies on the retina, but it's not proven yet. So let's just talk only cornea. Let's break down corneal transplant. Corneal transplant can happen because of multiple factors. Chronic eye disease leading to corneal ulceration is one. Pseudophakic, that means a patient who has undergone some surgery in the past and because of which his corneal, one layer, is the corneal endothelium, the inner layer of the cornea, has gotten affected. And for that, there can be a transplant being done. Or you can have a Fuchs dystrophy, or any of these dystrophies basically causing one of the layers not being formed very well.
Completely, yes.
It could be a congenital issue. It could be something else. We don't.
It could be a genetic mutation that leads to an incomplete formation of the layer, and that requires a new cornea.
That incomplete formation of the layer leads to translucency or opaqueness of the cornea. So it's an optical reason to do it. So I'm not doing it because there's a therapeutic reason. It's not an infection that I have to remove. I'm doing it because optically there's no light passing into this cornea. Cornea's main function is to remain transparent. That's his only job.
Because the light has to pass through back and forth.
That's their only job. The light has to pass through this. If there's no light passing through, I cannot stimulate the retina. If I can't stimulate the retina, the brain doesn't see anything. can't see anything, I have a lot more factors coming in: cognitive, emotional, physical, interaction, social, all that is interrupted. So that's, we leave that part of it aside. We'll come back to corneal transplant. Corneal transplant has, I told you, multiple factors and reasons. In today's world, we are very fortunate that we are able to do the right layer can be transplanted correctly. So cornea is made up of 6 layers, not 5. Earlier it used to be 5. Somebody just in 2013 discovered a new layer. So it's made up of 6 layers in the cornea. The top 3 and the bottom 3. I'm not going to go into names, it's quite confusing. The top 3 layers can be transplanted for a top 3 layer problem. The bottom 3 layers can be transplanted for a bottom 3 layer problem. So it's called as lamellar transplant.
That's how specific it is.
That's how specific we have gotten. And so much so, eye donation is when somebody donates both their eyes. So what do people think? Each eye can be used for one person, correct? So I'm taking the whole cornea and giving it to one. But because of this lamellar transplants, we can take 2 corneas from one person and donate it to 4 people. Because we can harvest only the top layer, we can harvest the bottom layer of one eye, harvest the top layer of another eye, and the bottom layer of another eye, and transplant it into 4 people, individually specific to their conditions.
How fascinating.
I've pretty much done this not just in India but also outside of India for helping, because corneas are very, very seldomly found. They're not easy because there's so much taboo around corneal transplant. Oh, I do not want to give my father's eyes. I do not want to give
Let
my
me ask you
mother's
this.
eyes.
Why is there a hesitancy in eye donation more in India compared to other countries?
It's a purely a cultural and a religious belief in, and to each their own, and rightfully for whatever reasons, but that's been ingrained in us from our ancestral cultural taboos that have been created, that once the deceased is born, you have to bury them, or you have to burn, or cemetery, or any of that. That is something that it's changing, but it's a very slow change, Dr. Pal. I wish it was faster because there is need of cornea so much.
So
in
you
India.
said you do 1,200 corneal
1,200.
transplants per year, and you belong to one
One
institute.
group.
There's so many other. Look at how many corneal transplants we need per year.
There is already a registry of close to about 8 million people are corneal blind in today's world. So you can just imagine the magnitude of what is required. What is 1,200 versus 8 million
Yeah, correct.
requirement?
Correct. So that eye donation after a loved one has passed away, the good thing about that is that eye can be given a new life into a new person. So basically, your loved one is still living.
So I give you a simple. I put this in practice. My grandmother and my grandfather's eyes have been transplanted to 2 people. This was back in the day. This was when this technology of lamellar transplant was not there. It was transplanted back in the day to 2 people, and I still see them, those patients. So I can still see my grandmother's eyes or my grandfather's eyes. So it's been something that you put into practice yourself.
Wow, what a good thing that you have done. And I only when you talk about this, it is very emotional.
Yeah,
when you actually see them through their eyes. And I remember that this needs to be done very fast, right? Within like 2-3 hours.
It's a brilliant question. That's a brilliant point, because it's such an emotional point. Every eye donated should be removed from the person at least within 6 hours. You have a window of 6 hours that you need to donate. And within that time span, our people have to go there, deal with the emotional aspect separately of that death happening in the family, secludedly take out the eyes, make it look normal again, and come back safe and sound and alive. So,
just a question.
yes,
When
please.
they take the cornea out,
Yeah.
do they fix it back again?
No. So earlier, back in the day, we used to do the whole eyeball. We used to
Enucleation.
enucleation used to be done, that you could take the whole eyeball out, but that kind of looks a little bad on.
Gross, correct.
It doesn't look good. So what we have started to do nowadays in most corneal transplants around the world, they take only the button of the cornea and come back. So the eye kind of looks pretty normal. The tautness is there. You close the lids properly and suture them up. It's done in a very nice manner, and then you don't have to be sorry about anything that you've done when you come out of that.
In US, while you are getting a driving license, so in the driving license, they will ask you organ eye donation, yes or no.
Yes.
And they, by default, it has chosen yes. Which is a good thing, because sometimes people don't know what they are looking for. It's a good thing for eye donation. But I asked them, why are you having this eye donation? Because there are lots of road traffic accidents that's happening. And because the corneal transplant has to happen within a certain time, like 6 hours, they don't have time to talk to the family and everything. If your eye donation is checked on your driving license, you've consented for eye donation
Yes.
already.
Yes.
And that guy was pretty sure that I will end up in an accident. And that's that's why he kept on asking me. But I have checked it. I have checked eye donation, and I
Right.
have asked all my family members to check as well.
No, but that's a really good thing in the US. I'll just compare the two, not for any comparison reasons, but
There are good and bad things on
on both sides.
both sides.
On both sides.
We'll take the good things and leave the bad thing, like Western toilet, back in the US itself.
So the good part about corneal transplant and eye donation in the US is that there is an abundance of corneas available in the US, which are now being transported outside of the US for Africa, for regions where there is so much taboo that you can't do transplant. All these countries are getting corneas from the US. It's a huge advantage. In India, because of the cultural taboo, the religious beliefs, or any of these aspects, we are not able to even give our own Indian nation enough eyes. So, so there is a drawback here in terms of supply and demand. If I shouldn't be calling it supply and demand, because it's not a product. At the end of the day, it's an organ.
No, it's just a rational
Yeah, it's a
behind
rational.
our explanation. So hopefully, after this podcast, based on your recommendation, everybody should be at least open for discussion of corneal transplant.
Please donate
Eye
those
donation.
eyes. They can really go a long way in helping one another's soul, and you'll always have the connect emotionally that my mother's or my father's eye is still there in the world. That's a huge aspect which we don't actually take into consideration.
Strong. Thank you for pointing that out. That's awesome. That's awesome. So we talked about dry eyes. We talked about blue light. Now the biggest question is this myopia thing you're talking about, and the number is really exaggerated. I mean, really bothering me. 1 in 2 people at 2050 throughout the world will have myopia. Means that we are focusing on the kids now. So 6-year, 7-year-old now kid, if we don't focus on the screen time, going outside and everything, there are increases of myopia. For example, I have myopia. So they, during the, in schools, they check for your annual visual exam, and I was not able to read the last 3 lines. So they had my glasses right away. For the next exam, I memorized everything already on the board, and then I was able to tell them, even though I didn't see it properly.
So many people
So
do
many
this.
people do that. You see the A? No, I can see the Z itself. So, and after that, it slowly progressed. I started at -3, which was around 6-7 years of age. It went up to 5.5. At what age does it stop growing or increasing?
Right. So myopia overall starts somewhere around 7-8.
One more other thing, when you say myopia, people always say power of the eye, right? Oh, what is your power? Is that generally myopia?
No, no, it's not. Okay, let's break it down. Refractive error overall can be split into 4 parts, 4 components. It could be in combination, but predominantly 4 different parts. Myopia, which is minus power.
Minus is you cannot see far, you could see only
Correct.
close by.
Correct. Then you have plus, which is hyperopia. Hyperopia is you cannot see close, you can see far. Okay. Third is astigmatism. Astigmatism is different from these two because this is basically your dome shaped round cornea has become like the back of a spoon. So on one axis alone, there is power, on the other axis is normal. So you start looking elongated or skewed in some ways. That is astigmatism. And the fourth one is presbyopia. Presbyopia is age related, 40 and above kind of thought process. It's changing to 38 and above because of our lifestyle changing. But anything to do with age related is called presbyopia. So we leave the presbyopia part aside. We'll talk about these three or maybe only the two. Hyperopia is less common. Astigmatism can come in combination of either of these two. Myopia with astigmatism, hyperopia with astigmatism. I hope that gives an analogy of where are the refractive errors that we are dealing with.
But the most common is
Most
myopia.
common is myopia,
Myopia.
any day. And most of the treatment options also have been focused towards myopia because of the incidence being so high. So much so, let's break down myopia in the younger age group. Let's talk about first treatment, right? Let's talk about treatment. If you talk about treatment of myopia above the age of 18 and below the age of 18, there is no treatment for below the age of 18 because the eye is still growing.
Eye stops growing at the age of 18.
18. Okay, so 18 is my ballpark to give everybody. 18 and below, don't do a refractive surgery until you absolutely need it. Like if you have losing vision in one eye, okay, I will do it. Apart from that, there's no reason to do it. So 18. Above the age of 18, you have LASIK, you have SMILE. These are the two major procedures. LASIK is basically a 22 mm big cut is made all around, a flap taken out like you have an orange peel. How many of you have seen an orange peel, right? If you see an orange peel, you peel off that, shoot the laser at the bed of that orange and put it back.
Wow.
What we are doing with LASIK is basically restructuring the eye, restructuring the shape of that cornea. In other words, I am sculpting. I'm sculpting on the cornea. So if I'm sculpting on the cornea, I need enough thickness on that cornea, number one. If I sculpt on something very brittle, it can break, it can rupture, it can do anything. So I need enough particular thickness. So we keep our safe ground before we do any of these procedures. In interest of not confusing the audience, I'm not going to tell you the numbers because it's very confusing.
Yes.
So I need to sculpt on the eye. That is LASIK. So I've made a 22 mm big flap, like an orange peel, shot the laser and put the flap back on.
This is what they call laser surgery.
This is called laser surgery. It is done in 2-3 formats. You can use a blade to do this. You can use laser to make that flap. Okay. Now let's go to SMILE. SMILE is exact analogy is very simple. You had the big surgical incisions before, and now you have the laparoscopic incision. You have the laparoscopic tube, which can go and do the same surgery and come back. In the same way, in the SMILE surgery, you're making a 4 mm incision.
Smaller.
From 22 mm, you're making it a 4 millimeter incision and taking out the lenticule. So you're basically making a sandwich with laser. So laser shoots here, laser shoots here. You're taking out this sandwich through a 4 mm incision. So
4 mm is so tiny.
It's so tiny. It's a laparoscopic. The analogy to this is the laparoscopic procedure. And that really has changed the way that your corneal nerves are preserved. Your dry eye is less. Your healing is better, stronger. You can go a little bit more with the thickness. So even if it's a little thinner, you can still do SMILE. So those have really changed how we do. So in our practice,
SMILE is taking over LASIK now?
Yeah. So in our practice, we used to do 100% LASIK. Today we do 70% of that is SMILE, and 30% is LASIK. So it's changed a lot around the world. Not in the US because part of that is because of the FDA not being approved in
Insurance does not approve.
Insurance does not
SMILE.
approve. So it's not technology. It's the regulations.
Correct. So the prognosis is good while when a patient gets laser surgery for his
Yeah.
glasses. Is the prognosis good?
It's a brilliant question, Dr. Pal, because this is something we fight every day. Laser surgery, whether LASIK or SMILE, is the most successful surgery on the planet. 98 to 99% success rate. But here's the big doubt, okay? The 1% that does not go well is predominantly because of bad judgment before or on table incidences that happen. Here's the question: why is it being highlighted so often? Because all these patients are younger age group. They're very tech savvy. They're very Google and Facebook and Instagram and Twitter friendly. So they will tweet about bad things happening. They'll never tweet about the good things happening, which is fair. And I would do the same. So it's fine. It's not wrong on their part. But that's where it gets all the attention from. Plus, it is a very elective procedure. So I'm choosing to go ahead with the procedure because I want to get rid of my cosmetic glasses. Fair enough. It's fine. Now, here's the doubt. Because I'm choosing electively, if something does go wrong, I'm not happy emotionally. My whole life is left. And so there is a lot of negative connotations when things don't go well enough, even if it's a judgment based point or a issue on the table, whichever.
Correct.
So it's not right or wrong, but that's why it gets all the importance.
So we see this all the time. Any kind of procedure related field, when there is a bad outcome, it is being projected significantly more. And that is not only with ophthalmology, any procedure.
Anything.
But the most important thing that the patient should understand is majority have good outcomes.
Absolutely.
And that is not being talked about.
Absolutely. 98% of the world's population that go through LASIK or SMILE or any refractive procedure are wonderful. In fact, they come and tell me this is the best procedure of my life. The person was not able to go to the bathroom before. He's not able to go to the restroom, not able to play sports. I'm not able to go swimming. I'm not able to look at a person if I'm without my glasses. Broke my glasses. So many things happen, which, and they're contact lens wearers. For 10 years, if I'm wearing contact lens, I will become intolerant to anything I'm putting on my eye for 10 years. So there are multitude of factors which are hugely advantageous to doing LASIK versus not.
Or like my incident when I stepped on my glass while I'm getting off my bed.
Correct. Yeah, most people.
Because I didn't know where the glass was.
Yeah, most people. It's not uncommon.
It's not uncommon. So that's a beautiful segue for contact lens.
Yes.
Okay. So people think that's a fashion statement for contact lens, but contact lens is not without any problems.
No.
What is the most common problem that you see with contact lens wearers?
Intolerance. When it happens is personally dependent on person to person, but they will become intolerant eventually. And then they'll start thinking, hey, I can't do LASIK now. But that's not the case. You can still do LASIK. You just need to come in and get yourself checked, whether you're eligible or not. The eligibility on LASIK is a big aspect. So I would say definitely contact lens is one. The second is if you sleep overnight with those contact lenses, there's a high chance you can get infected. Your cornea can get infected. It's a huge problem. The third
how common is that?
It's not common, but if it happens, it's quite detrimental.
Dramatic.
It's very dramatic, and it can be quite vision threatening and sight threatening.
I had a patient while I was in ophthalmology rotation where the patient is an artist. Okay, so she had a singing thing or something like that, and then she went to bed late at night at 11:15, and she completely forgot to remove the contact lens. The next day morning, she couldn't open the eyes because of the pain.
Acanthamoeba is pretty much the
right.
Acanthamoeba
infection of the
Acanthamoeba infection is an amoeba which basically sits in these contact lens solutions, especially when you're wearing repeat use contact lenses and you sleep with them. So they are stuck between the contact lens and the cornea. They start growing in the night because you don't have any blinking happening. So they start growing and they start penetrating into the cornea. It is a nightmare to remove, but we have to try what we can do. So contact lens
So we
problems,
talked about intolerance.
intolerance, contact lens infection, your dryness itself, you're straight away putting something on top. Obviously, there's going to be a tear film issues there. Okay, so this is one. Warpage. Warpage is basically it can change the shape of your surface of the cornea. Doesn't make it smooth enough again. So the warpage can happen. So especially when we are doing analysis or investigation for LASIK or any of the refractive procedures on the cornea, we have to be very careful that we take out contact lenses at least a week in advance before we do any investigation. So we
So
tell
that
them
it
be on
becomes
glasses for some time because I need to see your normal cornea, not your modulated cornea, which because of the contact lens.
So let's say I come to you as a patient. Okay, I am myopic. I am minus 6.5.
Right.
Not a good thing to say out in public.
It's a very normal problem.
Minus 6.5. You know, I'll tell you something. I think my myopia, I didn't have screen time on everything.
Right.
But my myopia is related to consanguineous marriage. I strongly believe. There's an increased risk of ophthalmological.
There is, but that would cause a more pathological myopia.
I see.
That means beyond -8.
Beyond -8.
Beyond -8, I would have, okay, other suspicion would be this is probably just an
It's okay. I see.
fine.
I see. Okay. So let's say I come to you and then I say that, hey, I don't want to have my glasses. I want contact lens.
Right.
Will you offer contact lens or will you recommend LASIK?
If your cornea is good and your dryness is not there and your corneal shape, thickness, other aspects that I usually check for LASIK workup, any day LASIK.
LASIK is better than contact.
LASIK
I
is.
see.
The reason is very simple. The motivation level that you need to put in contact lenses every day, you'll not do it.
Right.
You'll go back to glasses. And you'll not be the reason. There are obviously a reason why you're coming in. You don't want the glasses. There's obviously, maybe it's a cosmetic reason, maybe it's a functional reason, maybe you want to play sports. So many people come in. I'm not able to see the ball when I'm playing tennis. You know, the ball comes from the side. I'm not able to see. I'm playing snooker, whatever it is, whatever sport that you play, you need your peripheral vision to be perfectly fine. That affects. And so we need to do what we need to do in terms of that.
So LASIK is anytime better than contact lens.
Definitely.
Got it. And when it is contact lens, make sure that you have practice hygienic practices while you are changing and everything. That brings up the next question. You are from Chennai. You live in Chennai.
Yes, I live in
I'm
Chennai.
from Madurai. And we know in Tamil Nadu, the biggest thing is Madras Eye.
Yes.
It's called pink eye.
Pink eye. Red eye.
Red eye.
Yeah.
So Madras Eye is something very common.
Yes.
When you see somebody with a pink eye, I have seen people, they don't even look at them, that they think that they will get it.
Get it. Yeah.
Is that true?
That's a complete myth. No, that's a complete myth. But there is a very strong correlation of hand and face touch. So your hand and face touch, especially if you have red eye, please either don't touch your face or wash your hands every 20 minutes. Wash your hands with soap and water every 20 minutes. It will reduce the spread even to the other eye. It will reduce the spread even to the other person, specifically because we are touching our face close to 10,000 times a day is what I've been told.
That's somewhere the number is right, because there was same number for touching the nose as well.
Yeah.
Almost.
Because
of the COVID exposure, they actually did the study.
Yes. So
Involuntarily.
You don't even know it. You'll be
know it.
touching. And so that touch leads to some other touch to somebody else or some surface. You even touch a surface and somebody else comes and touches that. There's a very high chance that can spread because of that. It's not because I looked into the other person's eye. That is too romantic to my own liking.
We do that when we are growing up in school.
Yeah, we do that.
Because it is Madras eye, which is pink eye. It's an infection of your conjunctiva.
So let me just remove one myth over there. A lot of times when people are viewing screen time so often, because they need to focus, because the eye is being used so often, the blood vessels do dilate a little bit. And it starts looking a little pinkish, reddish, whatever you want to call it. That's normal. That's not red eye. So just demarcate the difference between that and a red eye is basically you will have any of these 4 symptoms. You'll have watering, you'll have redness, you'll have pain, or you'll have itching. Either of these four has to be there for you to call it a red eye. And if that is there, straight first of all, don't go to work that day.
Good
Go
point.
to a clinician, get yourself checked so that you're not spreading this to anyone else. 3 days, at least 3 days, be on medication, and then you can start doing. Even if it's red after that, it's fine because it's not contagious after that. You're not giving it to someone else.
Correct.
Uh,
But it's highly contagious
it
because
is highly
of just
contagious.
hand and
It's highly
touch.
contagious, especially if it's a viral. It's very contagious. If it's bacterial, it's less contagious. Fungal, it's even more. So
For viral and bacterial infection, so redness of the eye could be two reasons: viral infection, bacterial infection, or allergic. That's another
fungal
thing as
also
well.
is there.
Fungal as
Yeah.
well. But the most important distinction is between viral and,
And
the
bacterial,
bacterial,
yes.
because bacteria needs antibiotic drops.
Correct. And viral does not have a treatment other than time. And you have to put antibiotics as well because you do not want a super added infection. You already have a viral. Your immunity is going to be low. At least put an antibiotic so that you don't get a bacterial on top of this. It should not be an adjuvant in the negative way. So that's one major thing.
And the major difference is for a bacterial infection, there'll be a whitish or yellowish thick discharge.
Correct. Bacterial, there'll be a yellowish discharge. In fungal, there'll be a thick white discharge. And in viral, you can have a watery discharge or yellow ropey discharge. It's a lot to do with my slit lamp. That is the machine I use to examine at 400x magnification. So I obviously need that when it's a micro organ like this. But yeah, that's what it takes.
Beautiful, beautiful. And people always wear the glasses, correct?
Yeah.
Why is that? Because of the photosensitivity.
They actually wear it so that they don't show the others what they have. Plus, it adds a huge aspect of face to eye touch. So it protects you even in an involuntary movement. You won't touch your eye. So clean your glasses with soap and water, those protective eyewear, so that you don't touch your own eye.
What are myopia control glasses?
When we put normal spectacles, a myopia spectacle for a child, the refractive rays that are entering will hit one focal point all across. So the peripheral retina, which is round like this, does not receive the rays as is. It receives it behind. Peripheral retina receiving the rays behind triggers the eye or the retina to say, hey, I'm not seeing well. Let me elongate the eye more. So it triggers the eye to increase the myopia, increase the eyeball size. That's why you're triggering the eye to increase. Your focal point is good, but because the peripheral ray is not hitting properly, you're increasing the eyeball size. What we're doing with myopia glasses or myopia control progression glasses is that within the same spectacle, not you and me, the manufacturer itself is putting the prisms and sending it in a way that these rays are not hitting linear. They are hitting in a curved fashion.
Wow.
So it does not trigger the eye to elongate. That is one. Second thing which people are doing is putting atropine drops for children, which is not the best thing to do because you need a chronic use of these atropine drops throughout the age of this myopia. And it's not something I'm very pushy for.
I see. In the so I remember reading this somewhere where if you're a myopic, if you're a nearsighted people, the power increases until you reach 18 because the size of the ball is increasing.
Because the spectacles were not made for a curved eyeball. They were made for a linear eye. So it's point A to point B, but it's not point A. It's a curved fashion. So that's the change which the people are trying to bring about with the myopia control glasses.
Wonderful. Hopefully
it's a big one. Hopefully we'll be able to see a huge reduction in the incidence of myopia. So this whole concept of number of incidents of myopia increasing should come down over the years.
Good. Nice. Medicine is as advanced as it could get.
And innovation is such an important part of growth, and we all are learning as we go along about different ways to look at the same problem. Myopia has been there for a while.
Right.
Why did nobody think about this earlier? It's an evolutionary process rather than anything else.
Of course. Coming back to general topics as well, where there are some myths surrounding eyes, correct? So one of the most common myth is, you should not look into the sorry, you look into the eye, sorry, you look into the sun directly so that your eye health get better.
Oh my God. It's a complete myth. I recommend and I actually propose, please do not do that. It is not just, it's not good for you. In fact, it is the exact opposite. The minute you look into the sun, and if you know why they give you solar glasses for the solar eclipse, it's because the sun rays are directly harmful to the macula or the central vision of your eye. It can burn your retina as much as burning your retina. What they used to say about looking into the sun was when the sun rises, because at that time the sun is not actually there. It's actually way beyond. It's because of the rays looking down. Even then, I would definitely recommend do not look at the sun. When you're going outside, please wear sunglasses. There are UV rays outside which have a direct relation to cataract, age related macular degeneration. These are conditions that are directly related to UV rays. So I would definitely recommend wear sunglasses when going out. If you need to wear prescription sunglasses, please do that as well, but only while going out. If you're doing sunglasses inside, like all the celebrities today are, and we all follow some of these celebrities, and we all want to do that what they do. If you're doing it inside, understand you're playing with the dark and light cycles of signals to your eye, to your mind, to your brain. And now from here, your circadian rhythm is changing because you are now fooling your own body to believe that it's dark, but actually it's bright. And you'll not be able to sleep well. Again, the same cycle of circadian rhythm starts playing.
I see.
So be careful where you're wearing these sunglasses as well.
I see. That's why all the celebrities are wearing in the afternoon because they have nighttime shooting.
Some of them are wearing inside parties inside the house.
You
also.
know?
So yeah.
This is just an off question.
Yeah, of course.
When I go for the glasses, they give an option of having the tinting
Oh,
in the
brilliant
glass.
question. No.
Is it good?
It's not a bad thing. It's actually, those are called as photochromatic glasses, and they put in a chemical in the glass which basically light tints the glasses, especially on photo, when the sunlight hits the glasses. It's not a bad option. Some people find it confusing, but it's a transition phase of learning between the for the first 1 month, and after that you get used to it. Not many people do it because they're not used to that, and I think they would rather remove the glasses than keep it on all the time.
Got it. Okay. The other myth that my patients have asked me is they're rubbing the eyes. Is it
Huge.
good or bad?
Rubbing the eye is never good. People love rubbing their eyes. Let me let's be honest about it. People love rubbing their eyes, although it could be a real problem there. There could be a dryness issue because of which they're rubbing. Now that rubbing causes a very straight trigger to the eye, can cause, I wouldn't say it causes, the rubbing can cause a straight trigger to the eye to cause a condition called as keratoconus. Keratoconus is when the cornea, that is the window to the eye or the transparent black surface of the eye which you're looking at, starts going from a dome shaped to a cone shaped. So it starts becoming a cone. When it starts becoming a cone, it's a Greek word, means keratoconus, means your cornea is becoming like a cone. What happens here is the refractive error. You cannot find a glasses that can fit this, first of all. So you need surgical intervention. You need to do cross linking. You need to do cares, a new technique that has come out, and or you need to do an uh, rigid contact lens so that it changes the optical surface. So what's happening is your optical surface, your optical refractive surface has changed. You put a contact lens on top, which basically changes the refraction again.
Is that the ortho K? No, that's
Ortho K
different.
is different.
That's
I'll come
okay,
back to that.
okay,
It's a
okay.
very different one. That's a
Mm.
good point. These are called as mini scleral lenses. They don't sit on the cornea, but they sit on the sclera. They're larger, and they have a aqueous layer in between, so that it changes the whole model of the eye.
Is it because of frequent rubbing?
It is because of frequent rubbing.
Ah.
It could be because of genetic chromosomal abnormality. It could be because of hereditary. It could be multiple reasons why keratoconus comes in, but it's a huge problem around the world, even in India. It's not uncommon.
And other common myths, I have seen Instagram. I mean, a few of my subscribers have sent those Instagram videos to me where they put rose water into the eyes.
Yeah.
What are the other things
So
that you have seen in your practice?
castor oil, rose water. They'll put I forget the haldi, turmeric. All these are non-beneficial. They are harmful to the eye. Straight up harmful. Without a prescription, please don't put anything in the eye. It is non-warranted. It does not help. Ayurvedic drops. I have nothing against Ayurveda when it goes into the system, but when it comes to the eye, you're playing with acid and alkali. And these are all pH controlled, transparent systems that you have to. That cornea is so precious that anything going wrong, it will cause a straight opaqueness on a blinding to the eye. They put oil, they'll put, things which are castor oil, if I'm not mistaken. They put this, for small, simple redness and all that. They put anything that somebody recommended, or a pharmacist who's not even a pharmacist in this thing is given it.
As you said, it's a very complex organ. It's a very small organ, and there is no room for error.
There's no room for that.
So already we are dealing with a small real estate.
Absolutely.
So you better take care of your real estate very properly. It's like a Mumbai apartment.
Yeah, I tell people, you have to take care of your eyes like as though it's your child. Would you give something wrong to your child? I mean, you're doing it to your eyes. Please don't do that. Get a recommendation. You always call 4 or 5 people before you say where your kid should go, what your kid should be eating, and you get all those recommendations. Let's start doing that a little bit more with your eyes.
So the another fashion trend is using kajal.
Yes.
And how does that affect the eyes?
Okay, kajal is very, very common, especially amongst the ladies. What happens with kajal? Where is kajal really put? The kajal is put predominantly on the lid margin. So what people do, and I'll just show this because everybody needs to see this, they lower the lid and they put kajal inside on the lid margin. If you put it outside, there's no problem. If you put it outside under the eyelashes, no problem. The problem starts when you put it on the lid margin inside. That lid margin is such a prime real estate for the meibomian gland. The meibomian gland secretes, as I had mentioned earlier, the lipid layer for the
Cornea.
for the tear film.
Tear film, yes.
So the tear film lipid layer is secreted by the meibomian gland. By putting kajal chronically, once or twice it's fine, but if I put it chronically, I am blocking those pores. There are multiple pores on the lid margin that secrete the sebum. Now this lipid layer is not being secreted. What's going to happen? The aqueous layer is coming from the lacrimal gland, but there is no lipid layer to protect the evaporation. So it's either getting evaporated or it's falling off. It's not sticking to the eye. So a lot of people say, how can I have dryness? I am tearing. That means I am having excessive. No, it's not excessive. It's just not sticking. It's not staying, so it's rolling off. So the meibomian gland dysfunction caused by the kajal putting is because of the blocking off of the pores. That's one. The second, when you block these pores, if it gets blocked, the gland is still secreting. So it starts stagnant fluid collection. So when there's collection of fluid, it starts getting infected. This is called as a stye. This
STYE.
is STYE. Stye is when the meibomian gland starts increasing in size, becomes stagnant, becomes infected, and now this is a repetitive process because you're not stopping the kajal, you're constantly putting the kajal. So even if you treat it, again you go back and do this, you're going to cause this whole dryness, meibomian gland dysfunction, the stagnant stye formation, and now you have to do a surgical procedure to express this pus. So it's called a Collabs surgery. So you have to
Yeah.
open up and remove that pus.
I've seen that.
Yes.
The gland is enlarged.
Yes.
So you take a small micro
Nick.
knife and then you incise it. I've seen
Incision and
pus
cure.
coming out.
Yes, a lot of it. In fact, we have to remove the pus till a little bit of blood comes out, then we know, okay, all the pus is out.
It's painful.
Yeah,
No, you inject local
we
anesthesia.
do a local
but you don't have
anesthesia.
that much amount of real estate as you said.
Yeah, fortunately, we don't have to show the scar outside because it can be done from the inside. So we invert the lid and do it inside. No scars and stuff.
Similar to how they apply Kajal.
No.
They were
much, much simpler is to avoid putting the kajal itself. I mean, but to be honest, you put it from outside, there's no issue. But inside on the lid margin is a big issue.
So all these small things around the eye has some function to it.
Always, always. That's why it's such a complex and small real estate, but has so many functions. Think about it. We did a survey. I mean, there was many surveys have been done before. Which is the most essential sense organ? Like 80% of the world believes that eyes are the most essential. If I lose my eyesight, even for 10 minutes, close your eyes and try to do anything, you'll not be able to function. Just simple. 10 minutes, can you close your ears? Yes, I can. 10 minutes, I can stop smelling? I can. If I can stop tasting, I can. But I can't do anything without eyes. So 80% of the world believes that it is the most important sense organ in the world. And 8.1 billion people in the world, 1.1 billion have refractive error.
We're going to wrap this up by having you share a patient experience that you have had, where it's a very rewarding experience for you, which from a ophthalmological standpoint.
Patient came to me with a blunt injury with a cricket ball.
Cricket ball.
Hit. And this patient then had a very bad uveal, had a rupture of the sclera. Uveal prolapse, that means the contents of the eye were coming out.
Contents of the way popping out.
Contents were coming out, and it's pretty gory in thought process, but it happened. And I had to go in, suture up, remove all the blood from the eye, ensure that I can put a lens in a very different technique, put an intraocular lens inside the eye, suture up the iris, the brown of your eye or the black or the gray, whichever color you see, suture that up to the sclera again and bring back the eye to some sort of normalcy. Patient went from seeing just hand movements here from beginning and ended up seeing till about the second last line on the board. So it was a very rewarding one because they thought the eye's gone and I would never see again. And I mean, till on the table, we still don't know what has happened. How bad is it? Has the retina detached? There are so many multitude of factors that can go wrong. In some scenarios, they really do go well as well. So we're very happy to say that it was a very positive end to it.
That keeps you going. Experiences like this that
For
keeps
sure.
you going.
For sure.
And then you can ignore the bad review on the Google.
You can never ignore the bad review on a Google. You never ignore it.
So a myth or a truth fact is eating more carrots is good for your eye.
Eating essential vitamin A rich foods is good for your eye, but not eating carrots only excessively is good for your eyes. Don't do that. It's not beneficial. In fact, excessive carrots can release more beta carotene in your bloodstream, which can cause carotenemia, and it can cause yellow dyspigmentation of your skin, and this basically is from the beta carotene and is non-beneficial to you. So having excessive carrots is a complete myth. Please don't have it. Have just enough what is required, and that's about it.
What are the other foods that you recommend for kids usually for eye health particularly?
So rich foods with green leafy vegetables for sure have a very high factor. Fruits, some grains, not all, some grains, nuts and seeds will help in pretty much all age group. Yes, even in younger age group. In the older age group, I would definitely go on to say add stuff which is having lutein and zeaxanthin sort of foods as well. Omega-3 fatty acids, which are
Tell me more about this lutein and xanthin.
Yeah.
Is that supplementing the carotene?
No, it's a good point. Lutein and zeaxanthin is basically pigments which are found in plants.
Correct.
But they're also found in the body in the macula of the retina.
Retina.
That's it. That's the only area they are.
So we'll just describe that in an even layman term for the macula and the retina.
Sure.
So retina is the back end of the eye.
Correct.
And macula is the one part of that retina
Perfect.
that is connected to the
Optic.
now.
So let me put it from behind. Extension of your brain is the retina. The retina is what the extension of the brain is. The central portion of your retina is the macula, which is where the lutein and zeaxanthin go and sit.
Beautiful.
Which is where they do multiple functions. One of them is blue light filtration. Second is they increase the visual performance. The third is they release antioxidants properties. They have antioxidant properties. They also cause a lot of, they also help in avoiding age-related macular degeneration, preventing
the macula to degenerate.
Senile or age-related macular degeneration. These are some of the aspects where lutein and zeaxanthin help. After a point, the body stops secreting it, so you need to supplement it. And that's why you start needing to have supplements on this after a particular age group.
So I have seen lutein and zeaxanthin supplements go crazy in the US market.
Even here.
Even here?
Even here. It's pretty evident that there is obviously a very high scientific rigor to it. And the aspect here is the motivational reasons to do it has to be there, right? People don't find that until they go to an ophthalmologist or to a doctor to kind of say, okay, this really helps me. There are antioxidant properties. There's no harm to it. Okay, I'll do it.
I see. In your practice, when will you prescribe these supplements to a patient?
After the age of 45, 50.
40-50.
Yeah. I would usually do it anywhere above 45, 50. Please start doing it.
So before 45, 50, foods rich in lutein and zeaxanthin?
They help, but
example?
you don't... foods rich in lutein, zeaxanthin would be vegetables, any form of vegetables, your grains, seeds, your fatty fish.
The omega-3 fatty acids also help.
Yeah,
I see.
They also help a lot.
So you're saying have a healthy balanced diet so that your lutein and zeaxanthin is good in your macula.
Absolutely.
And after 45, if the diet is not that good, then you may need supplements later.
Yeah. So let me break it down, right? I mean, supplements and what happens with a lot of people is just believing in supplements is not enough. Give a holistic diet or not even a diet. Let me put holistic guidelines to this whole thing, right? You have to have a balanced diet, number one, without which all these supplements have no impact. So if you're doing so much excessive carbs, if you're doing so much excessive sugars, if you're doing so much excessive foods in sodium and stuff, they're going to be bad for you. So then it doesn't matter if you're doing lutein, zeaxanthin. First, correct the major aspects of your food intake. Second, come to the supplements. Supplements can be in the form of omega-3, lutein, zeaxanthin, zinc, vitamin C, vitamin A related foods. These are the 5 I would say, ballpark, stay here, you'll be comfortable throughout with your eye health overall. Third one, if you have any conditions, a glaucoma or any condition, diabetic retinopathy, any of these, please take the required drugs, drops or medications that are required for that particular segment also. Hypertension, any of those systemic conditions. If you are able to get the diet, the supplement and the medication all together, that really helps the overall health and can increase your longevity in life overall.
Beautiful. Super. Sounds good. That was a wonderful discussion. I learned a lot.
Thank you so much.
I learned a lot.
We learn a lot from you in terms of the work that you've been doing.
Thank you. That's so nice of you. Thank you so much for your time.
Thank you so much.
Thank you. That was a wonderful episode. I learned a lot. I'm sure you did as well. Please write down in the comment section in terms of what you learned, so that writing down will actually make you practice as well, because it will emphasize the point even better. So I would want you to write down in the comment section in terms of what you learned from this episode. And also, please check out my other channel, Gut Feeling with Dr. Pal, with clips where we are releasing 8 to 10 minute clip of the important information discussed in a hour-long podcast. And we have also opened up a new channel called Gut Feeling with Dr. Pal Shorts, where we release 1 minute video from the longer format of the podcast, presenting you mostly the important features. If you want to listen to this podcast in an audio format and not in a video format, please check us out in Spotify with the name Gut Feeling with Dr. Pal, and please consider supporting us by subscribing to that channel as well. As usual, thank you so much for all your continued support. We'll bring an excellent guest next time, providing the most updated medical information to you so that we can all grow together by learning medicine along with me.